Today we've got with us Senator Johnny Isakson, who's a United States Senator, has been in office for many years now, both in the Congress and in the Senate, and has always been a champion for global health and has increasingly become a champion for national public health institutes. He certainly has been a major advocate for the U.S.'s National Public Health Institute, the CDC. So let's hear what Senator Isakson has to say about his views on global health and national public health institutes.
Well, global health is important to me for a lot of reasons, but it's important to every single human being on the face of this earth because a pandemic, unabated, unstopped, could wipe out the population or at least significantly reduce the workforce, an available food supply, and national defense. So it's probably the most critical thing that could happen to a nation to destabilize its security and its economy and ultimately its life existence itself. You know, bacteria and diseases don't recognize airplanes, they don't recognize boundaries, they don't recognize governments, they don't recognize oceans, they just go where they want to go. They're blowing in the wind, so to speak. So having a vigilant effort and a coordinated effort internationally where all nations are focused on the health care of their country, but the cooperative health care of the world is the most ideal thing we could possibly have. There's no question Zika and Ebola are the threats, but they're only evidence of what another pandemic could be. We don't know what the next pandemic is going to be. We only know there's going to be one. While we not know what the name of it is, we know what the result of it will be. When an outbreak takes place, every second is an enemy that you lose, that you don't take advantage of. The CDC is our nation's health center, but quite frankly, it's the world's health center. But CDC is important because it's a catalyst for good health care. And there's not a place I have been in Africa, which is where I've traveled most, where CDC is not probably the best known American institution of anything. I mean, they really appreciate CDC because they've seen their loved ones die of AIDS. They've seen what these runaway diseases can do, and they know that prevention is a long way towards protection, and protection is a long way towards eradication of things like Ebola and all kinds of things like that. Ebola started in West Africa. It moved quickly and made it to the United States. Those 4 isolation beds at Emory University, which they had the foresight to put in place a few years ago, became a life-saving investment for 4 human beings who got Ebola in Africa. They didn't stop the spread, but had we not had them in that capability and 12 others around the country, isolation beds, we could have not stopped it. But the fact that we had the foresight to do it, and now we've learned a good lesson and it saved lives, but it's also important that we invest in that type of capability in our country in the years ahead. So if we have another particular spread of a radical infectious disease of some type or a pandemic, that we're able to respond with isolation chambers early. And if you have the early awareness where you spot them, then you have a way you can react to them. Then it's a way you deal with pandemics better than any other way I can think of. And that's why all these many CDCs around the world in each country are so important, because then you get awareness worldwide. So if something begins to happen that just doesn't look right, or it looks different, or looks dangerous, or looks possibly like a pandemic, you can begin to get the information out right away. It's only a matter of time before the next new thing is there, and we've got to be ready to respond with the next new treatments there to prohibit a pandemic from developing and spreading.